All right. I don't know how many of you are aware of this whole Medicare extra crap that's being pushed, rather than Medicare for all, the one that Bernie Sanders and many of the progressives are pushing, which covers everything: your dental, your vision, your, your medications. Uh, it's a full spectrum coverage, which is what Bernie Sanders and all everybody else that's a true that truly wants progress, that truly wants health care and not health insurance. Um, so this is something that's being talked about, and I'm going to tell you that that Medicare extra plan doesn't work. It will be just as bad as what we have with private insurance, because uh, okay. So let me begin by explaining something. So I collect early Social Security, and with it comes Medicare, Part D. Uh, and when I was on it, I used to have Medicaid on top of that. Now Medicaid is part of the state, and this is when I was in Massachusetts. Well, when the corporate Democrats and the Republicans got into it, not just in Massachusetts, but almost all across the board in the whole of the United States. What ended up happening is they cut off people like me and others on disability, and then they put restrictions on the Medicare aspect, and also gave license to the health industry, and to take away, instead of covering you for actual medical costs, they gave they allowed the hospitals and other health companies to take out administrative costs, so that 80% of the Medicare that I'm entitled to that pays only covered the administrative costs, and without the Medicaid, I had you go to a emergency room, or you get this massive jump in copay. So whereas I used to pay no copay, or a very small amount of copay, like $10-15 maybe, if that. Now I can be paying. I pay $100 in copay, and I'm on early Social Security, and I don't have hundreds of dollars to dish out. And then, but even back then, it didn't, even with the Medicaid part of it, it didn't cover dental, it didn't cover vision, and it didn't cover a lot of stuff. So with what I have now is I got Medicare without the Medicaid, and it doesn't even cover the actual doctor coming to see me and in the emergency room, or doctor's coverage. They're paying for the doc. It's administrative costs. And I actually ended up calling Medicare about it, and they basically said, "Well, there's nothing we can do about it because each state has its own rules and so on and so forth, and we can only and we don't have the bargaining power. We don't have the authority to make these, to enforce that. So basically, there's a scam going on. There's a criminal felony happening, and so that's another way. No, it's another way of them attacking uh, Medicare and Social Security and all that other stuff. So the whole Medicare extra TYT on Rebel HQ was talking about it with some doctor that who ran for office, but he's also knows about this issue, and he's talking about it's better than what we have, but it really isn't, because in a nutshell, I've just explained to you what Medicare Extra is. It allows for loopholes. It allows for extortion. It allows for dozens upon dozens of ways to get around it. And so, with the Medicare Extra, you're still going to pay up the nose for a lot of things, because there's going to be dozens of loopholes, and because states, quote unquote, have certain autonomy, they can jerry rig it and for whatever, uh, for those who bribe them, and without uniformity of common laws that are applied federally, going countrywide, there can always be this rigging. So with Medicare for All, which is going to be the ones that Bernie Sanders and Alexandria Ocasio-Cortez and many others of the new batch that are in there, got in the midterms, they're the ones, and the other ones calling for this full spectrum Medicare for All, uh, where they're going to be able to do everything, because the one that Bernie Sanders and the true progressive representation, they're trying to make it so that there won't be any loopholes, that you will get full coverage, and you won't have to have uh, uh, massive out of pocket uh, costs. Uh, you'll be you'll pay a couple of dollars for your prescriptions. You'll get possibly a couple of dollars for your prescriptions, uh, and you'll get you may have a small copay when you go to your doctor, or no copay whatsoever. And this gives and because of this, it gives uh, the Medicare administration and Social Security to actually have bargaining power and enforcement power, so that so that these things work, and they can force the drug manufacturers, and they can force uh, hospitals and doctors' offices uh, to have reasonable uh, sums charged, and they can make sure that they don't play these loophole games where administrative costs uh, is is what gets paid, and then you're left holding the bag for everything else. It can also restrict, paying $100 for friggin' Tylenol, or ibuprofen, or aspirin, that sort of stuff. These are the sort of things that Medicare, true Medicare for All, the full spectrum one, will give, versus this privatized system, where and they use privatized, but you know what it is? It's it's criminal action. It's an extortion. It's a criminal extortion, organized crime uh, with legitimacy, with the pseudo legitimacy. It's basically embezzlement, extortion. It's a pyramid con scheme, and it's all done with this legitimacy, because people, the quote unquote elected officials are allowing it because they write policy and legislation, which in fact is a crime because they are actually breaking laws. And I've covered this before. It goes against the Bill of Rights. It goes against the Constitution. It goes against actual laws already on the books, state and federal, which have not been rescinded. So, uh, so when the Supreme Court makes decisions that go against these sort of things, they're actually committing a crime. When you have state and federal courts doing the same thing, when you have DAs and and other places doing that going against actual laws that are already on the books, because there are common laws and common regulations and statutes that are shared federally and state and local, and yet these are being ignored in favor of laws which already break it and commit crimes by putting policies the such as the policy that allowed corporations to be people, which is Citizens United, and the one before Citizens United that allowed uh, corporation and wealthy people to have to get favor, uh, uh, prominent favor with the the quote unquote elected officials. So this is what I'm talking about. They haven't even taken out the laws that restrict all this, that makes it illegal, nor have they made amendments in the Constitution or the Bill of Rights. And this is the sort of, and so they're breaking the law. Gerrymandering, the fact that they allowed legislation and policy to do gerrymandering or super delegates, those are criminal actions. This the allowing lobbyists to come in, policies that allow lobbyists to come in, that's a criminal action. It's a felony. So all of this, never mind ignoring the laws already on the books about how one can advertise that uh, uh, deceives the people that watch it. That's again, that's another crime. That's another crime. That's another felony. The ones that allow this rotating door of allowing politicians and officials and corporate people in the corporate sector to have a revolving door. That's something else that's already in the Constitution, the Bill of Rights, and existing laws. You have all the Jim Crow. The Jim Crow laws were again a felony, a capital crime that was allowed, even though there are already laws on the books, as well as in the Constitution and in the Bill of Rights. So all of this. So the fundamental point is, crime is committed by those with legality. Whether it's your police, whether it's the FBI, CIA, it doesn't matter, or your elected officials, whether they're local, state, or federal, or those who are put in positions to be able to affect policy and legislation. Those are they are committing felonies, capital crimes, which is why I keep harping on them when I say treason. As an elected official, you cannot elected representative or a person in official capacity. They are committing treason. It's not corruption. It's crime. They're committing capital crimes. So, understand this whole Medicare Extra. They're committing capital crime by doing this, and thereby treason.